Hi there, Dr. Holly Rizzo here. Welcome back to our lecture series in pediatric dentistry. Today we'll be discussing a few miscellaneous topics in pediatric dentistry. First, we'll discuss trauma prevention and mouth guards, followed by CPR in children and infants, and finally, reporting child neglect and abuse. So mouth guards are appliances that are utilized to prevent the frequency and severity of dental trauma injuries. They're typically recommended and used for contact sports like hockey, boxing, and basketball. So there are three different types of mouth guards: stock, mouth formed, and custom fabricated. So let's start with stock mouth guards. These can typically be purchased over the counter and they're pretty inexpensive and are highly available at sporting goods stores. However, they're not molded to one's teeth, so the fit is not as retentive and they can be a bit uncomfortable to wear depending on the user. So, mouth formed includes the boil and bite mouth guard, which is highly available at sporting goods stores and is also considered to be pretty inexpensive. This style involves softening the guard in hot water and then molding the guard to one's teeth. The fit is not as good as customized mouth guards, and this may lead to higher wear and tear. Finally, we have custom fabricated mouth guards, which require an impression and a dentist. It is completely customized to one's dentition and oral anatomy. It can be formed via vacuum form or pressure lamination. While these offer excellent protection, they're also pretty expensive compared to the other mouth guards available. So make sure you're catering your recommendations to your patients accordingly. Next, let's review a brief summary with key points to remember CPR for children and infants. It's important to be able to recognize the following signs and symptoms. So first would be unresponsiveness, no breathing or only gasping, and no pulse. Then, followed by this highly tested and important sequence, first check circulation, airway, and breathing. Next, start CPR with a compression rate of 100 to 120 beats per minute. The pediatric CPR compression rate is a commonly tested number on the boards exam. So press firmly during compressions. These compressions should be over 1/3 the anterior posterior diameter of the chest and should allow for complete chest recoil. Interruptions in compression should be minimized as much as possible, and compressors should be changed out every 2 minutes or sooner to avoid fatigue. Compressions should be alternated with ventilations, and the compression ventilation ratio in pediatric patients is also highly tested. The compression ventilation ratio is 15 to 2 if there are two rescuers, but if there's only one rescuer, the compression ventilation ratio is 30 to 2. In pediatric patients, you'll want to provide one breath for every 2 to 3 seconds, or 20 to 30 breaths per minute for all pediatric resuscitation scenarios. Attach and use an AED as soon as possible and then resume CPR with compressions immediately after each shock. Finally, it's important to recognize signs of child neglect and abuse, and if all the points on this slide are extremely high yield. Importantly, there are different types of abuse, such as physical, emotional, and neglect. So, physical is intentional injuries of the body or face. Emotional involves denial of affection or isolation. And neglect is willful negligence to provide basic needs for a child. The most common age we see child abuse is from 0 to 3 years old. Dentists are required by law to report suspected child abuse and neglect, even if there is no proof. Dental trauma is a possible indicator for child abuse and neglect, so we always want to ask questions. One should consider take caution and ask questions when there are unexplained facial bruises or severe childhood caries that are untreated for a long time. Oftentimes, signs of physical abuse appear on the head and neck in children, so as dentists, it's important to be aware of these signs. So let's summarize what we discussed during this video today. We discussed some miscellaneous topics, including CPR, child abuse, and mouth guards. So most important to take away from this is that dentists are mandated reporters for any suspected child abuse or neglect. Thanks so much for joining, and tune in next time for more learning on pediatric dentistry. Bye!